Helen. Hi, everybody. My name is Paulette Dietz, as Helen said. I work for the University of Pittsburgh in the School of Dental Medicine in their dental hygiene and dental assisting program. Like Helen had mentioned, I also had the opportunity to work alongside PCOH, and I'll get to share some really cool initiatives that they put forth with their workforce development. Just my disclosure statement, I don't have any financial relationships or conflicts of interest to disclose at this time. Like I said, we're going to be looking at current challenges that the dental assisting workforce in Pennsylvania is facing, pathways, retention, recruitment, all of those good things that have been brought up today. We're really going to focus on our entry-level positions of dental assisting. We're also going to get to evaluate some initiative approaches, things like curriculum design, which is one of my specialties, clinical partnerships alongside our FQHCs, and then just strengthening that pipeline altogether. We're also going to look at some actionable steps and strategies that everybody in the room can participate with as soon as you walk out or leave this room today. So you might be asking, why does this matter? Dental assisting and entry-level workforce is something that I think is kind of overshadowed just a tiny bit in our career step. And if I had to ask all the dental providers to kind of think about their day-to-day without a dental assistant, whether you're a hygienist or a practicing dentist, if that assistant calls off for the day, your probably first thought in your mind is, oh crap, what am I gonna do, right? They truly are the right hand or left hand men and women in the force field that is kind of supporting all of our providers. But they are really essential to that delivery of care, but then there's also roles that they're starting to step into, more administration, even patient prep, infection control. Pennsylvania is facing a lot of supply and access issues, which obviously we have talked about today, especially in those rural and underserved areas as well. Kind of taking a look at our data snapshot, this all comes from PCOH's reports that they put together, but also from the Bureau of Labor Statistics. Our most recent is from 2022. There's approximately 10,700 dental assistants in the state of Pennsylvania that is documented or surveyed, which most of those would be EFTAs, because the only way to pull this information is looking at credentialing, which, as most of us know, in the state of Pennsylvania, to be a dental assistant at an entry-level source, you don't have to be certified in dental assisting per se. Maybe radiology is a little bit different, but then EFTA. So it's only accounting for the ones that have some sort of either certification or credentialing behind them. So I'd like to think that it's a little bit more than this, especially from our dental assistants that we might pull to train, I say, off the streets or in-house, just depending on where that licensure or certification level's at. They do have a projected growth over about 3% into 2032, which is about 1,500 jobs annually, but I hate to break it to you, most of those jobs are going to be retention issues, so it's replacing the current people within our own workforce. That's kind of where our loss of dental assistings come in. Most of our loss was over that 2019 to 2020 time period, which we all know is a big thanks to COVID. But some of our related issues that we're focusing on for our entry-level positions was lack of pay, and then, like I said, those retention as well. I already kind of mentioned our certifications among DA, but specifically we're going to look into EFTAs as well. Only about 25 to 27% hold an EFTA certification, and I think it's because it's pretty scarce to find training across our state as well. So when we look at where the workforce is located, those disparities kind of start to become a little bit more clear. Obviously, we've been touching a lot today about rural and urban split. 17 to 23-ish% of dental hygienists and dentists practice in rural counties, which is a very small number. So hopefully, using all of our great stances from this morning, that all of the great initiatives that are coming about in a collaboration, that we can hopefully do the same for assistants as well. And that's where our training programs are going to come in desperate need. So reinforcing those workforce gaps. So now the fun stuff. With PCOH, I got to look into a planning grant with four-state grant, which was Pennsylvania, North Carolina, Ohio, and West Virginia. And each state within our ARC counties got to complete an environmental scan, and we looked at 3 major groups: environmental factors and social determinants, workforce, and education. Workforce is what Pennsylvania was most heavy in, but with our social determinants and education, we were able to kind of fill some of the gaps of information that we would need. So to look at those disparities, this was our best way, was to conduct this environmental scan and then go from there in these regions. PA had 6 most at-need counties, which honestly we could probably add a laundry list more to these, but these are considered our most at risk. Allegheny, Center, Columbia, Forest, Fulton, and Sullivan were Pennsylvania's ARC most at-risk counties. This is looking at our DHPSA scores, which Caitlin just talked about, so I won't go too much into that. So very high DHPSA scores, as well as either no DA school in that county or even close by or a surrounding county. And then also just workforce numbers, so how many providers were in that area. For example, Forest County was considered severely critical because they only have 1 documented dentist and no documented assistants, FDAs, and other auxiliary members as well. So what are these challenges and how can we essentially address them and jump in 2 feet and say, how can we help? So looking at our current challenges, recruitment and retention is going to be our top 2 issues that we see among our entry-level workforce. Recruitment, about 87% of our FQHC respondents reported that dental assistant recruitment is low, is more difficult now than it ever has been, especially leaning up to those years of 2019 and 2020 amidst COVID. We also had about 391 respondents that are kind of left at the gate of 2020 that were saying they were either burnt out and that's why they left the field, or they were on the brinks of retirement and COVID kind of pushed them out the door. This also kind of leads us into what training and credentialing pathways can we do. A lot of times, and something that I see pretty frequently within my students, is that our providers are unsure how to utilize their dental assistants and their FDAs to the full scope of their practice. I got to work with a lot of different training sites within the University of Pittsburgh's dental assisting program, and the amount of times a provider would reach out to me and say, well, what is the dental assistant actually allowed to do? So answering that question kind of gave us more insight that we might not be utilizing them to the fullest because nobody is really sure what their scope of practice is. So looking at dental assisting, expanded function dental assistants, or FDAs, making sure that they're obviously coming from a grad-approved, board-approved program and certified correctly. But then if they are not an FDA and maybe have a license or a credential, if they're getting their radiation health and safety, making sure that they're using that to their knowledge and making sure that they're actually certified in those areas before completing that scope of practice. Also, I just wanted to note a lot of the lengths of traditional programs within the state of Pennsylvania take about 9 to 12 months. And I have found over talking with students applying to our program and amidst other schools in their programs, that's a very high turn-off rate for a lot of people. Most people do not, if they're not getting an associate's degree, don't want to spend more than about 6 months into a program. So it was kind of saying, hey, the shorter, the better for us, especially if they're pivoting in their career points. Looking at comparison of pay and job satisfaction, as you can see from this map here from the Bureau of Labor Statistics, Pennsylvania is actually pretty high up there with our means, but other surveys show that people are still unsatisfied with the pay rate that they are receiving as a dental assistant. It's about $22 to $23 an hour right now, but I bet if I asked a lot of the providers what they're paying their assistants currently to get an assistant, it's probably a lot higher than that, just to hopefully get somebody to walk in the door to help out. Job satisfaction surveys show that a lot of DAs feel underutilized, like we were saying with that scope of practice, and they want more responsibility, but they're not sure where to go from there. This is where our kind of gaps in service will then lead to. So our DIPSAs, or our dental health professional shortage areas, also looking into other auxiliaries like FDAs and PHDHPs. We really want to make sure that we're using them in these urban settings, but also making sure that we're filling rural, because that's where the most need is, as we've heard today. So looking ahead, what can we do to essentially drive forward and make sure the entry-level positions of our workforce are satisfied and also getting recruitment in? So as you heard from this morning, a lot of more blended and more training models are now coming about, which is great. These models are using a either hybrid approach or something that kind of maybe a shorter term in length of the program, but the hope is to essentially get people in the door to learn about the program. One thing that I'm very heavily like, yes, I want to do this, is starting to talk about careers earlier on in education, whether that's just having somebody guest speak at a middle school to talk about careers, and then hopefully from there we can jump 2 feet into high schools and establish that pipeline even sooner. Obviously, we need to align our training programs with community needs, so placing those programs or clinical experiences in rural communities are obviously going to help our pipeline even more. So actionable strategies, this is what I was saying, almost every person in here could do something as soon as they walk out the door today, which is obviously the hope and the goal. But just looking at it as a whole, educators, we can obviously expand our DA and EFTA programs, have some more flexible schedules. A lot of students nowadays either have to or need to or want to work while they're also in school. So having that hybrid model allows them maybe to do some work on their own time, which is great. But if we aren't doing a hybrid model, maybe then we can do night classes so we can actually retain more people after their traditional 9-to-5 jobs. Employers, so these would be our practices, our DSOs, FQHCs. Obviously, the big thing that we learned today from Caitlin was those mentorships, which I 100% agree with. A lot of times students don't know even about our career, so if we can pull more people in and then mentor them from there. But obviously, if they're in a program, maybe adapting them even sooner to either shadow, and then hopefully that would lead to employment down the line. And then policymakers and state agencies, obviously funding is one of our biggest issues across the state no matter what. You need money to do everything. So streamlining regulatory services can even help. Maybe being on boards to promote the Danby model would be great. For those of you that are unaware with Danby's model, the Dental Assisting National Board is actually trying to set kind of like a entry-level pathway model for dental assistants. So regulating some sort of credentialing would help even more than ever. With every innovation and implementation comes with our challenges, which we've been talking about today. One of those things is those regulatory constraints, but making sure that we're addressing our retention issues, as well as not just short-term recruitment, but long-term and what could be most beneficial to those entry-level workers. So in summary, we're hoping to expand those access to DA and EFTA programs, have new training programs, which we're obviously starting with today and heard about today, promote those employer best practices, so workplace, work and life balance, as well as culture, and then having policy incentives behind us. Our kind of next steps, we're hoping for more collaboration, pilot programs, obviously more data tracking if we can get better numbers and data, and having more promising models for anybody that's interested in coming into our field. I wanted to include my reference slide here because a lot of these references come from PCOH themselves. They have a workforce table over in the exhibiting hall, and I highly recommend to take a look at the workforce piece of it. Their reports are absolutely amazing, and it really shows the true raw data behind what's happening in our entry-level field. I always want to keep the conversation going as well, so please reach out to me. This is my personal cell phone number, which everybody tells me I'm always crazy to put up there, but I'm like, text me, call me. If you annoy me, I'll block you. No, I'm just kidding. But seriously, I love to keep the conversation piece going. The best way is to collaborate with everybody in the room to only move forward with all of the disparities that we're facing. Thank you.